Many people experience mild hip, knee, and shoulder pain, especially as they age. But it's important to realize when these nagging pains actually become a serious problem. That's why we've invited Dr. Russel Wilson to join us today, and he's going to talk about the pain management procedures that Wake Radiology offers. Dr. Wilson is a specialty trained musculoskeletal radiologist. Dr. Wilson, thank you for joining us.
Thank you. Happy to help.
What are some common causes of joint pain?
So, joint pain can result from a number of conditions. Certainly, there's broad categories, acute things like sports-related injuries, overuse, trauma. Then there are chronic conditions like degenerative joint disease or osteoarthritis.
Okay.
And then there are inflammatory conditions like rheumatoid arthritis.
What can be done for joint pain?
Well, the good thing is there are a lot of tools to treat joint pain. And certainly, medications like anti-inflammatories or NSAIDs have been used, often rest and ice therapy. Patients probably gone through physical therapy or occupational therapy. And then certainly for certain acute or inflammatory type conditions, or in the setting of chronic diseases like arthritis for protracted pain, your doctor may order a joint injection to help.
If I'm a patient, would I need an order from my doctor to get a joint injection?
Yes, this is done in the general context of that patient care. And so when your doctor and you decide that a joint injection is beneficial, then they order it.
How does image guidance improve the effectiveness of a joint injection?
Well, in the absence of imaging guidance, you're really doing an injection just based on your knowledge of anatomy. So I think for particular joints, that might work fine, such as the knee. But for other joints that are deeper or degenerated, so they're narrowed, or even particularly that superimposed on small joints like the feet, imaging guidance becomes very important. I think the most important reason is because by using imaging guidance, we can accurately confirm that we were truly in the joint when you instill the medication. So that's very important. If a patient does or does not respond, you want to know that you're exactly where you said you were. And then the other thing that imaging guidance helps with is we can easily adjust the course of the needle while we're doing the procedure, so we can just make it overall quicker. And then finally, if you're just relying on anatomy without imaging guidance, you really rely on a sensation of this loss of resistance when the needle enters the joint. Now, that often requires the use of a larger needle. So if we don't have to rely on that and we can just use imaging guidance, then you can use the smallest appropriate gauge needle, and that's more comfortable for the patient.
What can the patient expect after the procedure?
Well, we use a combination of medications. So often they'll have immediate pain relief from the fast but short-acting numbing medicine or anesthetic. That'll usually wear off in several hours. Then they may have a day or two of soreness. And then what you're really waiting for is the steroid to kick in, which is long-lasting, but classically takes about 2 to 5 days to kick in.
And how often can you inject joints?
Okay, so for certain processes like acute injuries or inflammatory conditions, the injection may do away with symptoms altogether. But for most conditions like arthritis, we know we're not curing the disease, we're just treating the symptoms and improving the quality of life. So for all comers in arthritis, we consider an average response to be about 3 to 4 months of pain relief. And in general, you want to space out the injections between 3 to 4 months, so that can allow for 3 to 4 injections per year if needed.
Okay. What other pain management procedures does Wake Radiology offer at the Outpatient Imaging Center?
So the good thing is we have a lot of tools to treat joint pain. Fluoroscopy is what we've been talking about for joint injections, and that's basically real-time x-ray.
Okay.
And we can use fluoroscopy for other things as well, and that includes just doing arthrograms of the joints, where you put some contrast or some fluid into the joint, and then the patient goes on to a diagnostic imaging modality like MR or CT. But then other imaging guides include ultrasound. So often we can do pain procedures under ultrasound guidance for bursitis or injecting a tendon sheath. You can drain cysts, and we can also treat calcific tendonitis in the shoulder rotator cuff. And then we can use CT guidance for other joints like the sacroiliac joint and the pelvis.
Okay.
And then we can use CT or fluoroscopy for spine procedures like epidural injections or facet injections or sacral hiatus injections.
Excellent. Dr. Wilson, thank you for joining us today.
You're welcome.
To learn more about the topics Dr. Wilson discussed today, visit our website at wakerad.com.